because we do want to take some time to go through the details of the report, and we'll do a presentation, then we'll take some questions, more question answer, more educational approach on the content of the report. So those more detailed questions, I suggest those who want to get into them stay back, and those who have to rush off and leave and meet deadlines, can leave whenever is convenient. I apologise for the some of you have to stand. It's active living. So we can take some general questions now
As a medical doctor, how concerned are you about the development of the shale gas industry in the province?
We have taken a look at this industry. As I said, we've spent many months looking at potential impacts, and we believe that it is necessary that certain recommendations and measures be put in place to protect the health should go ahead. So in terms of the extent of concern, I think there is enough evidence and from other jurisdictions to suggest that these measures are necessary.
So, as there is many things that should be done before we go ahead, would you agree with some kind of a moratorium?
No, I know that there are strong opinions on this industry on both sides of the debate, both for and against this industry. The approach we took when we started to do this work was to say, we need to be ready in the eventuality that this industry does go ahead. And I think it was the only ethical and sensible way to approach it. And so the question we asked ourselves, if we are to assess the health risks, we need to base it on the assumption that it's economic, and that's what we did. However, and there are measures that I firmly believe need to be put in place before we move forward with development. In a way, the question about a moratorium to me is somewhat moot, because we have been assured that there is plenty of time before the industry happens to allow these measures to be put in place. I think if that wasn't the case, we'd be having a different discussion. But the situation is that it's not this year or next year, that there is time, we've been assured.
What key measures do you see have to be in place before anything further develops? What are the key ones?
This set of recommendations they work as a set. They look at the different components, and I don't think we can say one is more important than the other. They really work as a complementary set of recommendations. The scale and the scope and the extent to which they're implemented will depend on the pace of development, and so as the development ramps up, then more resources would need to be put in place. But all of them need to be looked at before the development goes ahead.
One of your recommendations is the health monitoring of anyone who lives, works, or goes to school near a site, in essence. I'm sure we'll hear about the technical reasons for that, but that seems like a huge undertaking. How big a project would that be? How expensive would it be?
Well, the core function of public health is health assessment. So we need to know what are the things that impact upon people's health if we want to appropriately plan the health system. And so we should be doing this anyway, in terms of looking to understand what causes disease and injuries and what makes people healthy. And we do, to a certain extent, in this province and every province, look at health assessments. I think that could be strengthened and improved, particularly in the area of environmental exposures and in association with industry. I don't think we're particularly strong in that front, whether for shale gas or other industries. So I think when we have an opportunity to do things right,